From KETK, you're watching East Texas Live.
Welcome back to East Texas Live. It's National Public Health Week, and Dr. Janet is here to discuss the importance of your annual health screenings. Thank you so much for being here today.
Thank you so much.
Yes, ma'am. Let's talk about it. Annual health screenings, specifically cancer screenings. You know, what are some of the most common types?
Right. So we have excellent screening tests for breast cancer, colon cancer, cervical cancer, and lung cancer, as well as prostate cancer.
Yes, ma'am. When do you think people should be getting those?
Yeah, so each of these different conditions have different age ranges, but for mammograms, we usually would like to do that starting at around age 40 to about age 74, and then with risk factors perhaps a little bit longer. Colon cancer screening starts now at age 45 and goes up to about age 75, and higher than that if you have risk factors. Lung cancer screening starts usually at age 50 to 80, but only for those people who have smoked more than 20 pack years and have not quit smoking within the past 15 years. And then we have cervical cancer screening for age 25 to 64, and then also prostate cancer screening for some men starting anywhere from 55 to 69, although we do sometimes start that earlier at age 45 for those men with risk factors.
Yes, ma'am. You know, we're talking about annual screening. Why is it so important that we get those?
Yeah, so if we can catch cancer early, and these are the screening tests for which we have good data that tells us that if we can catch cancer early, then we'll be able to treat it early, and a lot of times be much more likely to lead to therapeutic cure, which is what we all are hoping for.
Yes, ma'am. So is the importance of early detection, is that for early detection of?
Yes, sir. So we want to detect cancer early so we can treat it early, so we're much more likely to lead to cures and potentially have less need for really difficult to manage chemotherapy.
Yes, ma'am. And you know, COVID was a couple years ago.
Right.
Do you feel like that kind of impacted screenings?
Absolutely, yes. So we saw declines in our cancer screening rates anywhere from 25 to 35%, depending upon the individual disease category. And we've also seen a decrease in cancer incidence rates, which we believe is simply because we're not catching the cancers that are already walking around in our community.
Yes, ma'am. And just tell us about how you and Christus are trying to help, you know, bring that awareness to everybody.
Right, yeah, so we have patient portals where we, let patients know within their own personal healthcare portal what they're due for, so that they know what it is that they can potentially reach out and get these things done, or call and get it scheduled. We even have text message reminder alerts that are going out to some patients for one of our lung cancer screening pilots. And we have a mobile mammo unit that goes around. We also have tools built into our electronic health record, so when patients are seen in the office and they see our office staff and our clinicians, that they can be reminded at that point right there and get these things ordered so that they can get their screenings done.
Yes, ma'am. What does it mean to you to be able to, educate the public on getting these screenings?
Right. Well, it's always very while we don't ever want to find cancer, we're always so grateful when we find it early. And so it's encouraging to me, not that I'm ever happy that any of my patients are diagnosed with cancer, but when we catch it early, I'm usually very relieved as their physician. So it's inspiring to me to ensure people understand the importance of getting these screens so we can catch these cancers early.
And whenever you kind of catch those early, what's the process that y'all kind of go through? Yeah,
so each cancer is a little bit different, and so usually once we catch the cancer, then we usually will take a biopsy to try to confirm that that's what we're dealing with. Some people are treated with surgery, and sometimes surgery is a cure. We just cut it out and then we're done. Other times we have to move to chemotherapy and other treatments that are sometimes a little more difficult to manage, and then lastly we have radiation too for certain cancers. But again, catching it early will make it much more likely that we'll be able to get a therapeutic cure rather than have something that persists for a long period of time.
And where can people get more information about the screening?
Oh, absolutely. So they certainly could speak to their individual physicians. They can check on the American Cancer Society has a lot of very patient-friendly information that will help patients take a look and see which cancer screenings are most appropriate for them.
All right, Dr. Janet, thank you so much for coming in here and educating the public on that. For more information on your annual health screenings, you can go to the website right here on your screen. Up next.